A new Kaiser Health News and NPR investigation found that 100 million Americans are saddled with medical debt. That report was released on June 16th and pointed to the ways that medical debt is more pervasive across our country than originally thought. Their findings pointed to some of those hidden debts, the ones put on credit cards and supported by loans or gifts from family members to try to make ends meet. The report had several key findings, and we'll review a couple of those here. The first one was that more than 50% of adults have reported that they've gone into medical debt in the past 5 years. About 25% of Americans with medical debt owe $5,000 or more, while about 10% owe $10,000 or more. 20% of Americans with medical debt say they don't think they're ever going to be able to pay off that debt. And as we already knew, medical debt is the most common form of debt on consumer credit records. Now, there are disparities in that data as well. Black adults are 50% more likely, and Hispanic adults 35% more likely to have medical debt than their white counterparts. Illness is a stronger predictor of medical debt than either poverty or insurance status, and medical debt is nearly twice as common for adults under age 30 than those age 65 and older. The impact is huge. 63% of Americans with medical debt have been forced to cut spending on food or other essentials. 17% have declared bankruptcy or lost their home. Medical debt is blocking patients from receiving care, and their data says about 2/3 of those with medical debt have put off needed care because of the cost, and 1 in 7 report being denied access to care because of unpaid bills. In the report, they call the picture bleak, and a notable quote from the report says that debt is no longer just a bug in our system, it is one of its main products. You can read that report and its key findings in its entirety. We link to it in the description below, along with some of our own resources on how to challenge medical debt and collection actions, and some other resources to help.